Dr. McGirt is a gifted neurosurgeon who has performed some miraculous posterior spine surgeries on patients to give their lives back, has significant experience in research and clinical publications in brain and spine, including patient outcomes, analytics, and risk stratification. Not being a runner, he ran a half marathon just for the hell of it after partnering with a patient who he performed spine surgery on, and then went on Ellen's show and Today's show to talk about it.
What's fascinating to me about this metal is that it is superior in almost every way we measure, every metric of how we look at metal we implant in human beings, whether it's durability, whether it's biocompatibility, corrosion, reactivity. It's really amazing. There are two ways to leverage this technology. One that you've hinted on is that we busted the glass ceiling, right? This is really a class leap forward that really propels us to be able to do so much more, particularly on the size space. So you can leverage this, as you mentioned, in almost any application for a orthopedic or spinal implant to have equal or superior performance at a fraction of the size. The other way that you leverage this that's also exciting is in things like deformity surgery. Even if you want to use standard sizes of 5.5 or 6.0 rods, is astronomically better in durability, and that's another direction that this is applicable. As you see here with the in MiRus's interbody, it is the softest modulus on the market. It comes very close to cancellous bone, and these are just some of the market leaders out there. There's publicly available data you can compare to. When it comes to softness, reduced stiffness of those interbodies, this really hits it out of the park. The other component or property that's so important as we're learning is quite frankly, how hydrophilic is this? How much wicking do you have? How easy does the bone marrow, the blood, the fluid wick into it to promote true biology of healing? And this is now FDA approved, which is fantastic. And if you look at really the architecture here, it is the lowest effective density. This is essentially the amount of metal or material within a given volume of space. It was designed based off of micro CT images to really match the morphology and geometry of the cancellous bone, and its behavior, I think, is the best thing we have right now to promote bony fusion. Here are some images that just give you a little bit of a sense of the size. When I first started thinking about smaller rods, so what does that mean? I quickly realized that the mass of the entire dorsal exposed hardware in posterior fusion, cervical, thoracic, or lumbar, are driven by the rod size. Smaller rod, smaller tulip head, smaller set screw, more bone, smaller stab incisions, less inflammation, etc. And here you can just see the perk screw. The application made perfect sense. Now here's a couple of cases. One on the left, this is a 1-year post-op of an L2 to pelvis, had a coronal abnormality, significant multi-level stenosis. And I began to start with 1 and 2 level, but I've been using this 4-5 rod for long constructs, T10 to pelvis, L2 to pelvis, L2 to S1. And like this 1-year shot, I've really not had any problems with pseudoarthrosis, rod breaking, or a 4-5 rod not being durable enough when you actually apply it to some of these tougher cases. Other areas we've found great application here in our level 1 trauma center is pediatrics in smaller, younger folks, and especially thoracic cases. The profile is so small, we rarely are having kids or adolescents complain about feeling the rod or the tulip heads. In elderly osteoporotic fractures as well, same thing. These are cases where it matters, where patients are having less erosion of the metal through the skin or pain from that. Anterior cervical, this is really taken off in my group. I've got 25 partners. We're a large group. We do 80% of our 1, 2, and 3 level ACDs outpatient at our ASC. It's not just that it's a smaller plate, but the width is unbelievably small. So when I finish my interbody work, my grafts are in, I'm never going back asking for the drill and bovie again to widen out my bone carpentry so the plate fits. Not only is it the thinnest and narrowest, but the malleability, as you can see here, how low profile on the CT it is great. Occasionally those cases where I used to have a little bit of a proud, played up at the top at C4, for example, it just doesn't happen. Even if it's a little proud, the malleability brings it right down. And I think it matters. It matters for dysphagia. It matters for blood loss and OR time. I'm not going back to the drill at the end of the case anymore. So it's really been a great addition to the armamentarium of what I do.